Happy noon, everybody. Welcome back for the second part of hormone cycle mapping with our friend and colleague, Dr. Jessica Parker. I'm Ingrid Bauer. I am the co-owner and co-founder of Five Flavors Herbs, and very happy to host Dr. Jessica today. I'm a Western medical doctor, and I got zero training in this in my background, in part because I don't practice women's health specifically. So I'm excited to learn a lot and hope you do too. For those of you who are not able to attend live, we are sending out the recording link to everybody after this. And everybody who attends today will also receive the link from last session if you didn't already. Hopefully, almost everybody has via one way or another. So without further ado, I would love to introduce Dr. Jessica Parker, who is a doctor of Chinese medicine and acupuncturist who practices in Oakland and in Nevada City, both of our hometowns. Well, new to us hometowns. And yeah, I will turn off my audio and let you take it from here. I'm going to manage both the chat and the Q&A, and hopefully we can answer most of the questions at the end, unless there is something, really critical that we need to stop. And I'll kind of flag Jessica and say, hey, can you stop? And we'll discuss this. All right.
Great. Thank you, Ingrid. Always a pleasure to work with Five Flavors and host or do any of these talks. I really, really love their formulas. I've been using Five Flavors forever since we were all in Oakland and we've all kind of have migrated together from Oakland to Nevada City. So here we are, part two, hormone cycle mapping. And just to kind of quick, welcome back if you joined us for part one. And also, if you're new to the series, welcome. It would be great if you could listen to that first. So we'll do a little bit of a recap today, but mostly we're going to kind of dive into the second piece here, which talks about the actual. We'll look at some case studies that looks at hormone cycle mapping and which formulas that I use in my clinic accordingly. So just a quick intro. Again, I'm Dr. Jessica Parker. I've been practicing acupuncture for about over 15 years now, and I integrated functional lab work into my practice around the time when I received my doctorate in 2016. And really, what drives my work here is when we combine the wisdom of East Asian medicine with modern functional lab testing, we really get something pretty incredible. We're not choosing between like Eastern, Western medicine. We're kind of creating precision treatment, I feel. And this is kind of what it looks like in my practice, for instance, and we'll look at a few lab markers. Hopefully, we have time towards the end to kind of get a summary and an idea of what I use, how I use blood work in my labs as well, aside from just cycle mapping. But we can see like blood deficiency, right, with low ferritin, low B12 levels. Spleen Qi deficiency will appear as low protein and other poor digestion markers. Liver Qi stagnation manifests as insulin resistance, for instance. So, suddenly like we have this tongue and pulse diagnosis is validated by real tangible data. And then the treatment can be pretty precise. So I use functional labs in my practice pretty much every single day. And I'm also teaching acupuncturists to integrate this approach. It's become a huge passion of mine. I love teaching other acupuncturists how to dive into this. And so in part one, we covered the framework of the four phases of the cycle, the Proline formulas that sort of are integrated within those each of those phases. So part two, we will look at real case studies. I have a couple case studies that I'd like to share, and we'll talk about some of the flex formulas that you can also use. I use them as an opportunity to treat the underlying constitutional patterns in addition to some of the diagnoses that we see with cycle mapping. So we'll cover kind of two different patients with actual cycle mapping data, either one with BBT charting, basal body temperature, and the other using like a urine metabolite test. These are like the new wave of cycle mapping. And then we'll look at how to combine some of that data with functional blood work to kind of guide us for the phase-based herbal prescribing. So again, little recap here of what we talked about. We dove into this quite a bit deeper in part one, but we're exploring here the four phases of the menstrual cycle through the lens of seasons, through moon phases, and the TCM energetics here. So we can sort of match each phase with proline formulas throughout an entire menstrual cycle. So we have the blood phase, new moon, that winter phase. This is when, during menstruation, the hormonal point should be kind of zero at a baseline. Everything should be at its lowest. Our treatment focus is really here to move blood, thinking of like four gates, moving chi and blood, but also simultaneously building and nourishing blood to kind of help complete that release and begin rebuilding. And so we use the Proline formula release days 1 through 3. This is based on Tao Hong Su Wu Tong, and that helps break up stasis gently, but also tonifies blood. And then in the yin phase, we have that follicular phase of the waxing moon, the springtime. This is when we're building. Estrogen is rising progressively. The body is preparing for ovulation. I like to use acupuncture points based off treating the Jui Yin pair, so the liver and pericardium to encourage yin and blood building during this time. There's a couple of formulas here. We have we're using a formula from days 4 to 14 of the cycle. We have enrich, cool, regulate, or energize. And again, depending on kind of what your patient needs, do they need deep yin nourishment, do they need heat clearing, liver chi regulation, or maybe more spleen chi support during that phase? And then we have the yang phase, which is ovulation. It's the full moon. It's the summertime. It's like that peak of the yang activity. The yang helps propel the fallopian tube fimbriae to like sweep up that egg. Lots of activity during this time. And it's when that middle dantian is the strongest and most active during that phase. So we can support the body, the yin support here, but also kind of uninhibited heart chi, helping smooth liver flow, allowing for ovulation to happen naturally. No formula is really specifically needed during this time if we have supported the blood phase and then the yin phase. The ovulation should just occur on its own. And then the chi phase, we have that luteal phase, the waning moon, autumn. It's after ovulation. That corpus luteum has produced what I like to call golden chi, which is just like full of warm progesterone. And that progesterone warms, it activates, it helps prepare the body, either if the goal is for implantation or if the goal is to continue on and prepare for the next cycle. So, formulas here are there to support smooth flow of chi, warm and stabilize the luteal phase, and you can use days from starting from days 15 until the next menstrual cycle, warm, lift, or unwind. And again, depending on what your patient needs, what their symptoms are, and what it looks like on their cycle map. And so, maybe we're doing more kidney yang support, maybe spleen chi lifting, or liver chi regulation during the premenstrual phase. So again, that's kind of the framework that we covered last time. And then before we get into some real case studies, let's look at some of the flex formulas that are additional formulas you can add. So what I love about these flex formulas is where we have the phase-based formulas that are more specific to like the natural rhythm of the cycle. And now we have, again, those are tied to when and where and when to add into the cycle. They help support that natural ebb and flow of the yin hormones, more yang activity throughout the cycle. But underlying constitution is still may not completely match some of those phase-based formulas. There's a deeper root that may be causing some sort of disruption in the cycle in the first place. And that's what I love about these flex formulas. They can really be added at any point in time in the cycle to address more of those underlying patterns that may not be phase specific. So we're treating the root while we're also continuing to treat using those phase-based formulas to match the natural hormone rhythm. So with Calm, this is a modified Gui Pitong. This is great. It anchors the shen. It powerfully cools the heart, and blood. It helps tonify spleen to control bleeding. It's great for relieving fatigue. Really emphasizes in that cooling the blood, calming the mind, makes it particularly effective for your patients with ovulatory dysfunction coupled with anxiety or maybe insomnia as well during their follicular phase. So, Gui Pi Tong, right? We have that spleen qi deficiency with heart blood deficiency. So you might see poor sleep, excessive worry, difficulty concentrating, palpitations, night sweats, headaches, dizziness, easy to bruise, maybe scanty or irregular cycles and period, pale menstrual blood, and spotting throughout the cycle. So this is when like that patient where anxiety, maybe poor sleep really is disrupting their cycle too. They can't build blood properly because that heart and spleen aren't really working together. Excuse me. The Shen is really unsettled. Blood is also deficient. Ovulation just kind of becomes erratic, or it may not happen at all. And so you can add calm alongside those phase-based formulas. And you can use like calm with enrich during the follicular phase, right? If they need more of that yin building and Shen calming, or you can use calm and warm during their luteal phase if like anxiety is interfering with implantation or something like that. And you can use calm on its own throughout the entire cycle, if that primary, issue is spleen, qi, and heart blood deficiency, right, with anxiety. So the point is the flexibility. So you're not really locked into the phase-based prescribing. You can layer these to treat both the constitutional and phase-specific needs. So sleep is also a great formula. If they have kind of that similar constitution, but insomnia is a really predominant issue. So this is Gui Pi Tong plus valerian root. And so you can use this instead of calm for your patients that, again, similar patterns that we just covered, but again, their sleep is their main concern. They're having more of that Shen disturbance with sleep. Transform is based on Longdong Shagan Tong, and this is really useful for addressing imbalances that are characterized by damp heat, right? So it has this diuretic action of draining excess heat, draining dampness, and especially from that lower jiao. It can be used for the treatment of migraines, tinnitus, irritability, any other conditions where like that fire is kind of blazing upward and we have that more congestion of damp heat in the lower jiao. Cysts, genital itching, herpes outbreaks, vulvar discomfort, yeast infections, excessive heat and sweating around the genitals, vaginal discharge, migraines, skin outbreaks, irritability, again, like kind of, and any sort of signs of fire rising. And so this is that patient where we have like liver, gallbladder fire descending into the lower burder. It's creating damp heat. They might have recurrent yeast infections or they get a herpes outbreak right before they start bleeding. They have headaches, migraines, and their cycle might be disrupted because of that underlying heat, and that dampness tends to stagnate the hormone production there. So like calm, you can use transform as like a flex formula, and it can be added at any point in the cycle to address underlying damp heat patterns, while you're using your phase-based formulas to match the hormone rhythm. So you could like use transform and cool during their follicular phase if they have kidney yin deficiency with those heat and damp heat in that lower jiao. You can use transform and unwind during their luteal phase. Like again, if they get yeast infections during that time or they're getting herpes outbreaks in that luteal phase, this is really great to blend with unwind. And this formula is actually particularly useful, again, for patients with chronic vaginal infections, with BV, especially when those antibiotics or antifungals are just not resolving anything. You can really start to use this formula to treat that underlying damp heat that just keeps creating an environment for infection. So again, these flex formulas, they're going to kind of give you flexibility. You're treating the cycle and the constitution simultaneously here. And then next we have Relieve, and this is based on modified Xiaofu Zhuyu Tong, drive out the blood stasis in the lower abdomen decoction. So this is a really great formula designed for people with like severe dysmenorrhea, pelvic pain, excuse me, endometriosis. I use this a lot for my endometrial patients, but it really relaxes smooth muscle. It strongly breaks blood stagnation. It helps resolve pain, discharges kind of like that stale uterine lining, and it harmonizes menstruation. So pattern here would be like blood stasis, chi, and blood stagnation here. And it's for severe dysmenorrhea. It can be for like scanty or incomplete menstruation, irregular menstruation, amenorrhea, maybe they're missing cycles and then it comes on really strong the next cycle. PMS, clotted, dark menstrual blood. This is really that patient with a significant blood stasis in the lower jiao. They have intense menstrual cramping, dark clotted blood, again, endometriosis or maybe even fibroids. So that pain is really stabbing. And it's kind of fixed. Their period, again, might feel like it's just not always complete too, because that blood isn't moving properly. And so relieve really should only be used when release is insufficient. If it's not helping, release isn't helping with menstrual pain on its own. So again, we use release from about days 1 to 3. And this already contains tauren and honghua to help move blood and break up stasis. And so for most patients, with mild to moderate dysmenorrhea or clotting, releases alone is enough during that phase. But for patients with like really severe pain, again, they've been diagnosed with endometriosis or fibroids, they have significant blood stasis, release might not be strong enough. So that's when you would add relieve. And so you can use it in a couple of ways. You can use relieve during days 15 to menses during that luteal phase. If the patient has severe blood stasis and they need that stronger kind of breaking action through the premenstrual phase into their next cycle. You could also, another option would be to use relieve as a flex formula anytime that blood stasis is severe. So you might use it alongside other formulas if endometriosis or fibroids are like disrupting their entire cycle. And then some practitioners you could also use during menstruation, again, for days 1 through 3 instead of release when the pain is really, really extreme and really intense. So again, I usually start with I'm sorry, I usually start with release. And then again, if that's not helping with their painful periods, then we'll add or switch over to relieve. Definitely be careful if they have really heavy bleeding. This formula strongly moves blood. So if bleeding becomes excessive, you definitely want to stop. So just a really quick one on this. This is the other formula of that's male factor, and this is the like I use this for my male enhancement formula, especially when I'm treating couples. I love treating couples with fertility in order to treat the whole picture. This formula is great for male factor tonification. It helps with yang and jing. It promotes movement with sperm health and like overall reproductive function. So again, particularly useful if you're working with male factor infertility, but also to use more daily to just support couples if you're treating both. So, okay, let's talk a little bit more about cycle mapping now and some of the tools that are out there. It's been like a wild ride. I like to try all the doohickeys that are out there, and I've tried them all. And I'm actually working with 3 different devices at the same time for my own cycle to just sort of see what it's like between like, some of the data between the differences of the 3. Um, and I get asked about hormone cycle mapping all the time and hormone testing. And there's a lot of confusing information out there. Even some functional medicine doctors, they're still relying on these little short window tests where they just have someone do a urine sample on day 19 to 21, right? And that completely falls short at showing the whole picture. So I just wanted to share a couple of my favorite options. One is super duper affordable, one less affordable. They kind of have their pros and cons, but overall, these are really great tools to look at the entire cycle. We want to look at from, even if they start testing right after bleeding, great, all the way to the next cycle and beyond. Much more than just trying to get a snapshot of hormones tested on one day. And ideally, you're using these tools for at least a month, but 3 months is what I really like to see from my patients before we really dive into a lot of treatment. So one, the my favorite option I have at the top would be the at-home urine metabolite test. And again, there's been all kinds of different options out there. But what's great about these is they measure the four critical hormones in urine. So you're looking at luteinizing hormone, you're looking at follicle stimulating hormone, you're looking at estrogen through its E3G metabolite, you're looking at progesterone through its metabolite. And so there's a bunch out there. I like Mira. There's a Nito. There's other just ones that are just sticks where you put in a urine sample and you can scan it to your phone. Um, anyway, but you're simply peeing in a cup and you might be testing every day or every other day. It kind of depends on the goal of what you're looking for in your cycle. Are you looking for fertility information? Are you looking to just manage your cycle? Are you in perimenopause? Are you taking HRTs? So there's all kinds of ways you can use these devices, and you might have a different time of when you're supposed to take a sample. But anyway, every other-ish day, you're taking a sample. And it either gets inserted into the device that reads the results, or again, maybe you're scanning it to your phone. It all gets collected in some sort of app, whichever one you're using. So the benefit again of these tests is that you're seeing the complete breakdown of these hormone metabolites. This gives you real-time data, really knowing what is happening with your hormone levels, and this kind of specifically the dance between them throughout your entire cycle. So you can really see estrogen rising during the follicular phase, or if it's not, you can catch some ovulation surges, tracking progesterone into the luteal phase. And this is the tool that I've been using more in my practice more recently. I've completely relied on BBT because they're awesome. There's great information from that, but I'm really kind of trying to direct patients to using more of these urine metabolite tests. With BBT charting, though, classic method in tracking your basal body temperature, great tool. It's absolutely the most affordable. You can get a BBT thermometer for like under $10 at CVS, and you can track it on a piece of paper. Um, and they also have fancier ones that do actually connect to Bluetooth or to your phone. But the BBT only measures that temperature. So not the specific metabolites of the hormones, but it still gives you really valuable information. Um, and you're consistently measuring your temperature first thing in the morning, even before you get out of bed or like snuggle with your partner or your dog or whatever it is. And it can really reveal information about hormone fluctuations, ovulation. We're looking at spikes and drops, and really more importantly with these, we're sort of looking at the entire pattern over the month. Is it up and down? We call that like sawtooth. We'll see a sample of that. Um, are the temperatures just like consistently super low? That might indicate some sort of low progesterone or low kidney yang deficiency, some sort of kidney yang deficiency, or are they running really high, maybe tending towards kidney insufficiency here? So there's many things that we can kind of gather from that BBT charting. And again, the cheapest option, especially if your patients are wearing wearable devices. So the Aura Ring is really popular. That's a really great way. Patients don't have to actually go and manually test themselves. They can just it just does it with their Aura Ring, and that can be really helpful. Okay, so here's a sample of BBT. This is like straight from their website. This is not a patient of mine. I'm just using that as kind of the starter page here. But this is from Natural Cycles, and this is what tracks from. Actually, you can connect your Aura Ring to Natural Cycles to kind of get the picture together into an app. So. These are some samples. If this is these slides are shared, these should be hyperlinks, and all of these are just different options that you can try. Again, a simple thermometer you can get at CVS for $10 to $25, and they go up from there depending on if they're BBT, I'm sorry, if they're Bluetooth connected, or if, again, if maybe it's the price really varies if they're doing wearable devices. Okay, so here is Allie is a 25-year-old I've been working with. Their chief complaint, they first started coming to me with hormonal acne and anxiety. Their acne was really increasing around ovulation, extended throughout the luteal phase, and often resolved once they started bleeding. Um, they have a history of IBS, chronic anxiety. That was another big reason they started to see me for acupuncture. They had just started like their big new first time fancy job, and it was a really high pressured situation for them. Their energy had been pretty tanked out from excessive anxiety that had been going on for a couple of years. They relied on these like sugary coffee drinks from in the morning all the way until the afternoon in order to like keep up with the high demands of their job, high stress in their relationship and their job. She did mention she just sleeps great, so that didn't seem to be an issue there. And she wasn't really able to do a lot of exercise and had a hard time kind of getting the energy to exercise. Menstrual cycle was very regular. Pulses were pretty deep on the right side, a little wiry on the left, kind of a pale, dusky tip, tongue with a red tip. And I do the Hara diagnosis. It's a Kiko Matsumoto abdominal diagnosis. And for any of you out there that are know about that, she kind of had a busy Hara activity going on. So here is her BBT charting. She was someone that was wearing a Aura ring, and I was like, "Ooh, I want to know, do you have that connected to natural cycles?" And she already did. So it was really great. We were able to just go back and start looking at the data that she had already collected. Um, and so we started to, this was the first month that I had started to work with her, and this is really that classic sawtooth pattern, right? Where temperatures are just like going up and down throughout the entire follicular phase into the luteal phase. And again, we sawtooth is very liver qi stagnation. That liver qi isn't flowing smoothly. Everything's pretty erratic. You can see temperatures fluctuating like wildly here through that follicular phase all the way through day 19. She's ovulating pretty late, but still having a somewhat of a regular cycle. And her chief complaint was that hormonal acne that flared mid-cycle and then right around ovulation, which really makes perfect sense again with that liver qi stagnation creates that heat, rises upward, manifests as like these skin outbreaks. And we know that she has this underlying issue of high anxiety, low energy. So here is actually the first cycle when we started treatment. I had her start with release days 1 through 3 to move that blood and support menstruation. Regulate, which is like Sydney San, days 4 through 14 to start to kind of smooth liver qi and address that sawtooth pattern during that follicular phase. And then I moved her into unwind during days 15 to her menstrual cycle to really help with that kind of like premenstrual liver qi stagnation. So you can kind of see here after that first month of those formulas, you're seeing in that follicular phase starting to smooth out a little bit, but still some ups and downs, not as erratic as before. And then ovulation here was started at day 14. So you can see those luteal temperatures are rising, still a little bit jagged, but we're certainly making progress here. And that liver qi is starting to sort of smooth out. But also we still know that there's kind of something else going on underneath. So by the third cycle that we're seeing continued improvement here. That follicular phase is much smoother. Temperatures are kind of coming down nicely where they should, especially after menstruation, and really staying relatively stable. Ovulation here was a little bit later at around day 16 here. That luteal phase, though, is showing like a good elevation with less fluctuations than before. And even though the sawtooth pattern is improving. Her acne was getting better. Her pulses were really showing a lot of blood deficiency, and her anxiety was like not getting better at all. So that was, she still had this kind of wiry active, activity in that liver pulse from that liver qi stagnation, but the majority of her pulses were pretty thin and weak, like classic blood deficiency pulses. So when we folded in her blood work and her labs, we right off the bat saw very low iron, red blood count was pretty deficient, hemoglobin, ferritin all really low, below the optimal ranges, and her total protein was really low, which is like a solid kind of like spleen qi deficiency sign. And so this is again where that cycle mapping and that blood work really like come together. And that BBT show, the BBT charting is showing that liver qi stagnation, which she certainly had. And the labs are showing us this underlying blood deficiency kind of driving a lot of the problem here too. So I added Calm to her protocol, and that to help tonify spleen chi, nourish heart blood. So now she's on release days 1 through 3, regulate plus calm during days 4 through 14. And then she has unwind and calm during days 15 plus. So this is the most recent cycle, and you can really see the difference here. That follicular phase, much smoother, less jagged, temperatures dropping again after menstruation, staying sort of stable. Ovulation is happening again around day 13 to 14. Nice strong temperature shifts here. The temperature, that luteal phase starts to stay elevated and get a little bit healthier of that in that phase than what we saw. Her acne has gotten a lot better, occasional mild outbreaks, but like nothing like she was seeing before. And while her job and relationship and kind of state of the world weren't going to change as far as her anxiety, she really started to notice more energy that helped her manage her stress. And she's experiencing more energy, more stability, and just more of again, more stability to manage the ongoing stress in her life. And so this was a really powerful combination, I felt like, with that cycle mapping, functional blood testing, and really looking at that, seeing the data and that TCM diagnosis kind of shift here. So again, we're seeing that liver qi stagnation from her cycle mapping, and then her pulse and her labs really showed this underlying blood deficiency. So we can treat all of that together. One of the things too, before I move on, what I love about this too, it's very not only is it tangible for you, this is incredibly tangible for your patients. They're actually seeing the shifts happen, right? It's more than just what we are feeling and what we can explain to them through pulses. I mean, this is lab work too. I always tell patients that, or my students, but they can use this data. It's tangible and it's visual for them, which is very helpful to keep them motivated. So we have liver qi stagnation with this hypochlorhydria, this like underlying spleen qi deficiency with heart blood deficiency. Hypochlorhydria is like basically like low enzymatic activity, which is making it more difficult to like break down things like proteins and more of the dense fuels, the dense macronutrients that we need eventually for fuel. And so the treatment plan I had for Allie, we have release on days 1 through 3. I did regulate about 60% to and calm 40% on days 4 through 14. And then I switched over to unwind with that combination of unwind and calm from days 15 until she started her next period. We're increasing dietary protein, working on acupuncture protocols to help with that spleen qi deficiency. And she's also on a liposomal B vitamin complex and weekly acupuncture. Very key. Okay, so hormone metabolite testing. Again, this is the tool I'm really loving now more than ever. Again, this picture is straight from the Mira website. This isn't a patient. This is like a way too perfect kind of flow. You rarely see like the perfect cycle map, honestly. But these are a couple of options. They do differ in pricing. I'm testing out these along with a couple of others right now, so kind of TBD. I will say I'm leaning towards the Mira. I just think that it's the most accurate. It's super easy to use. Some of the other devices are just a little bit fussier, which makes a difference. Both work really well. Price kind of comes down to just ongoing test strips and things like that. Um, and what they measure, again, unlike the BBT, that's really just temperature, we're looking at at those urine metabolites. So you can really see the specifics of each hormone here and how they're working together, kind of the orchestra of these hormones throughout a cycle. And so generally, I think this is similar with the devices as far as the color coordination. So the E3G is that dark, like that black line. We have the estrogen, that's the estrogen metabolite. We have LH, which is that light blue line there. And that shows, luteinizing hormone either surging or maybe not, triggering ovulation. And then we have the purplish line there, which is the PDG progesterone metabolite. And that helps also kind of give us an idea of what's happening throughout a cycle. And then the FSH is the orange line, which is that follicle stimulating hormone, really helpful for my perimenopausal patients too, to kind of understand what's going on with maybe potential diminished ovarian reserve or premature, ovarian insufficiency. So again, all of these are real in real time, really showing you the exact activity and how they're all working together. So, this is my perimenopausal patient, Sam, who's a 47-year-old and came to me with Mittelschmerz, that ovulation pain. Also started having irregular cycles, really painful periods over the last 2 to 3 years. Um, their cycles became irregular anywhere from 27 or 28 days to 39 days. And this also kind of coincided with taking HRTs. They've been on HRTs for about 6 months, has helped tremendously with a lot of their perimenopausal symptoms overall, but they noticed that the may have caused a little bit of wonkiness in their cycle with the changes in hormones. Um, that mid-cycle pain was really intense with painful bloating, low abdominal pain, again, right around what might be ovulation time. And they keep getting herpes outbreaks in that luteal phase, especially right before their period. It seems to be relieved once they start bleeding. Very irregular bowel movement. I'm sorry, very regular bowel movements, really well formed, not really an issue. They said that if they drink alcohol, they get diarrhea. But in general, no history of IBS or anything like that. A history of insomnia. They said that their insomnia was 3 out of 10, and it was getting worse into perimenopause until they started taking progesterone, and now they're sleeping 10 out of 10. So that was really supportive for them. So they are seeing some benefits of the HRTs. They enjoy exercise. Also mentioned a lot of being very irritable during PMS. They were hoping that HRTs would help more than they have. That did sort of smooth out some of their irritability, but they tend to have this tendency for that anger in that luteal phase. High stress all the time, but she says it's usually managed with exercise. And again, kind of an irregular cycle. Some heavier bleeding, but kind of generally getting shorter in the length of time that they're bleeding. And it was very painful now in day one. So their pulses on the right were really like kind of soggy. They had kind of this like soggy, squishy pulse feeling to them. They're a little bit livery on the left side, pale, dusky tongue, red sides, thick white coat, and then their Hara abdominal diagnosis showed tenderness at Oketsu. So, again, here we have a perimenopausal patient. They are on HRTs. So you can see clearly this purple line is totally at the top and it's probably even off the chart, really, technically. And that's because they're taking progesterone. So we're not going to really use that information as far as diagnosis or really be able to use that in the cycle mapping and prescribing herbs because it's just exogenous progesterone, right? And there were some fluctuations. That could be dilution. It could be that maybe she skipped the dose the night before. But again, it's not natural progesterone production. So, but we can certainly see the rest of the information here is really helpful here. And this is a 37-day cycle. This is the first one that when we first started working together, significantly prolonged. We have that estrogen line is rising, but it's really taking a long time to build. There was almost like a fake ovulation earlier on in the cycle, which seemed like that would have been ovulation. But that cycle was so long, so we can assume that this secondary peak was when she actually ovulated. Um, And again, just significantly delayed. And so you can see it also the chart, I'm sorry, at the bottom here, we have the date and then the cycle day. So you can see over here is cycle day and then the actual date of the month, just to make sure that that's clear there. But then we also see this FSH line, that orange line is elevating. It's definitely fluctuating, and this is and there. If you can see the numbers there, I think this is number over 10 and into the 20s. That's certainly kind of classic perimenopause. The body is working harder to try to recruit those follicles. So that FSH rises, ovarian reserve diminishes. And again, that purple line, we're not really going to use that information. But that painful ovulation, most likely from some sort of cysts, inflammation during ovulation. And then she's having these herpes outbreaks right before her period starts. So a sign of damp heat in the lower jiao. So this is kind of all telling me here, we have this kidney yin deficiency with that elevated FSH, more of the tending towards now diminished ovarian reserve, delayed ovulation. Plus we have this damp heat in the lower jiao, painful ovulation, herpes outbreaks. Then we started with one thing really quick to note, Sam stops her HRTs during her period to kind of try to have baseline zero. So she's not taking them all the time, which I think is really smart because it kind of allows the body to sort of refresh. So you can see it drops significantly down with that progesterone and even estrogen here. So what I put her on was release days 1 through 3. And then we had cool for days 4 through 14 to kind of address this high FSH and that diminished ovarian reserve, kidney yin deficiency with heat. Into the into the luteal phase, I was starting with unwind at about 60% of the formula, energize at 30, and then 10% of transform. And this was starting at day 15 on and this was to address liver qi stagnation, some spleen qi deficiency, and that damp heat. So you can kind of actually see some improvements even after that first month. What the cycle length is now back down to 27 days from 37 days. That follicular phase is significantly shortened. So you can see that she ovulated. Again, there's a little bit of pushing here, but a full ovulation happened during this time, which she did notice other symptoms of ovulation during that time. And you can kind of see that estrogen sort of steadily climbing from day 4 on. And then that more of that LH surge happening here. And it is a little bit more robust than before. So that ovulation, again, is happening more importantly, more closer to that timeline. That FSH is still pretty elevated. And again, perimenopause doesn't go away necessarily until you're in menopause, but we can, we're seeing that we would like to have a little more stability with that into perimenopause and then eventually into menopause. Um, and then again, high progesterone. So we're just going to, chalk that up to the exogenous progesterone that she's taking. So she did report though that during that ovulation time, it was a lot less painful and she did not have a herpes outbreak this time. So we're making progress, but I kind of wanted to address more damp heat a little bit aggressively. Another big factor here is that with Sam, when we ran labs, they had serious blood sugar dysregulation. They weren't diabetic yet. They weren't in that phase, but they were early stage diabetic, kind of leaning into that high level hypoglycemia, insulin resistance. And this is really related to liver qi stagnation. It really coincides with this like sluggishness of digestion, sluggishness to break down those fats and proteins. So by the third cycle, we're adding more transform here, starting on day 4. So instead of just waiting towards the luteal phase, I started at day 4 to manage that lower jiao damp heat more consistently throughout the follicular cycle rather than waiting until after ovulation, trying to address it a little bit before. So again, 27-day cycle. things are looking a little more predictable. I'm not really sure what went on with the progesterone. Again, there may be something with dilution. They're taking the same amount, so it might be dilution, or they forgot to take it the night before, so it's not showing up the same on the test. But we see that estrogen is really building well during the follicular phase, and it's peaking around cycle day, again, 11 to 13 here, then declining after ovulation, which is what we want to see. We have a little peak of that LH. It's kind of flat here, but again, we're not seeing a huge surge in that LH, and this can happen from a few reasons. It could be missed testing. We have a couple of days where she did miss taking a sample, so we might have missed that actual surge. It may have been pretty brief, or again, in perimenopause, those surges just can be sometimes weaker. And then again, that higher level and kind of wonkiness of the progesterone, I'm not too concerned with it because she's taking the progesterone. Okay, so again, no painful ovulation this cycle, no herpes outbreak. That damp heat is really clearing. Really powerful, example of kind of layer how to layer these flex formulas with those phase-based formulas, right? We have that cool to address kidney yin deficiency. We have that transform to address that damp heat that are causing maybe those cysts and those outbreaks of for sure. And then unwind and energize to really help support that liver chi and that spleen chi during the luteal phase. So this is Sam's most recent cycle, and you can see ovulation's really clearly marked at day 12. We have that estrogen line is kind of like steadily rising right in the follicular phase, the way that we want a peak before ovulation, a little bit better surge with that LH around, again, day 12, 11, 12 here triggering ovulation here. Elevated purple line, that's from those HRTs. And that FSH is a little more stable here. So kind of key takeaway, again, even in perimenopause or your patients on HRTs, we can still create and support natural hormonal rhythms, underneath those, exogenous hormones, and we can help support the body's natural cycle and regulate those cycles with these phase-based formulas. So Sam cycle so far have been really predictable, about 27 days. We have having timely ovulation. That painful ovulation has gotten much better. Herpes outbreaks have pretty much stopped in the last 3 months. And it feels like she's managing perimenopause with a lot more ease. So again, really, this is kind of with that precision treatment, using cycle mapping, using TCM diagnosis, functional blood work, phase-based formulas, and the flex formulas all together. So for Sam, again, we're using release on days 1 through 3. I was worried that that wasn't going to be enough, but it does seem to be helping with their period pain. Cool, about 80% and a little dash of that transform days 4 through 14. Unwind at 50%, energize with 30%, and transform. I have a little bit more in that luteal phase of 20%. I put her on a 10-day blood sugar reset program and weekly acupuncture. Okay, so I have a million more slides and I'm looking at the time. And of course, I blabbed so much. I always do this. So I'm going to skip over the remaining part of my talk today would be looking at more specifics of tests that you look at from a blood draw. So we won't do that. I'll reshare this slide. We looked at this last in part 1 as well. This is kind of like the full picture and how I practice using cycle mapping, whether it's urine metabolites or BBT charting. I love either of those. And then really looking at a functional blood chemistry panel. It doesn't have to be crazy. The test that I have my patients go get at LabCorp costs less than $180. So I like to look at a full chemistry panel, CBC, CMP, thyroid panels, really looking for these imbalances. Again, like our patient Sam, we're catching really early stage diabetes, well, far before they're even into that phase. And it can really validate and enhance your own TCM diagnosis. It's so tangible for your patients. That's probably one of the biggest benefits. It is this actual tangible thing you can send home with them, and they can see results shift and they can see progress in numbers or in these, the hormone cycle mapping here, and really helps with creating more precision when we're using phase-based formula prescribing, really identifying root causes and treating the underlying driver of hormonal imbalances. So I'm going to skip to my second to last slide here just to plug my little class that I do. I have a cohort. The fall cohort will be starting in September, on September 9th this year. I just finished the spring cohort. It's such a great group of acupuncturists. If it's not even just for the information, we dive into a full, complete blood count. We look at every single marker. We're identifying imbalances from both the TCM and the functional lens, really being able to, again, create this tangible material and data for your patients to follow. And they get so excited about it. Your patients love the information. It really helps motivate them for treatment plans. I love teaching this information. It's really become a passion of mine. We just finished the spring cohort. It's an incredible group of people. As I was saying, it's more than just the information that I'm here to teach. It's really about the collaboration of the other acupuncturists, and being able to kind of work in a cohort setting is really, really awesome. So I'm excited to be meeting the new cohort this fall. I'll send out a link with a little bit more information. Registration's not open yet, but you could get on a waiting list. All right, thank you. We have a little bit of time for questions, so if there are any, I'm happy to answer anything.
Wow, Jessica, that was amazing. Thank you so much. I just learned a ton and my brain is churning. Um, can I ask a question?
Yeah, please.
I'm thinking about that middle Schmerz, ovulatory pain in this patient who is having this sort of like stuttering. It's almost like I can see that like FSA is uh,
Yeah.
not quite getting there. And then there's probably a lot of um, I'm just imagining that there's literally um, follicles that are sort of developing, but not really. Maybe some rupture, some don't. So that could literally manifest as pain. And seeing
Hmm.
how the herbs are smoothing that out and alleviating symptoms is, and pairing that with the like symptoms and the data is so powerful. It's super exciting as a like Western mind person who likes the data to go along.
Right.
Really helpful to kind of because it's like you're getting to see under the hood.
Right. Totally. I say that all the time. Another teacher of mine that I love, like, I mean, could you imagine what like the ancestors of TCM like would have thought to be able to look at a blood draw in that way or look at this information, right? It is exactly looking under the hood and really being able to see these intricacies that could be missed in pulses or could be missed in even just like symptom, based diagnosis. And so it's such great information to be able to weave that together. And it's not even just for the practitioner, it's also for the patient. They're really able to understand what is happening to them in so much more details, I feel like, when we can present it that way.
My other question was in terms of this the with the progesterone one, it's really amazing to see an exogenous um hormone be literally so flat and seeing the pharmacologic effects of a standardized product like that
Right,
is pretty mind-bending because we don't get that sort of daily serum testing.
right,
I think we would probably do that with is blood sugar, and there's no way we would be able to get that type of
right.
perfect line. So that was just interesting from a perspective of, you know, so many people between GLP-1s and HRT. I feel like anytime I'm anywhere where I get advertised, my age just gets plugged in and I'm getting advertised both.
Oh, yeah. Yeah.
And so it's really interesting. I'm wondering if in this patient she started to be interested in either reducing her doses or stopping HRT, or if it was helping with other symptoms enough that she was wanting to continue on it.
Yeah, so that was what was interesting because she's on the lowest dose that's prescribable. It's the she's taking prometrium, which is 100 milligrams. It's a pill at night. And basically her sleep was the biggest driving force for her HRT new journey. And it was like, don't ever rip this out of my hand. I will be taking these HRTs for the rest of my life, which I was like, totally, because it dramatically shifted her sleep habits and just created like a whole new life for her. So that was interesting because prior to like the changes with HRTs, when they were unsafe or they were, questionable, a lot of people were getting on bioidenticals that are creams, and it was so hard to dose. And I found a lot of my patients back then weren't having the same benefits in the same way. Having the higher dose is interesting, though, right? There isn't a lower dose from using the pill form basically, which are bioidenticals, right? The HRTs that are available now, they are bioidenticals, which is so amazing. But yeah, it was kind of like, wow, I wish there was like the half, a half dose of this.
Mhm.
What would that look like? And I think also what's interesting, I'm trying to test out some of those markers are at the top, but does that mean they're just at that top? Are they literally out of the chart, even what's available to those cycle maps? So it's kind of hard to tell, but yeah, she was like, again, don't ever take these away from me. I'll be doing this for the rest of my life. So
That's great to hear.
yeah.
And then there was a question from the audience about range of time days from ovulation to menstruation. Um, I could answer that, but I'm wondering just in terms of who you're working with, it seems like you see a really broad range. Do you mind sharing
Mhm.
the textbook, what's normal, and then the range? I would probably maybe ask in different age groups, and also if that relates to especially, we didn't talk specifically about like pregnancy outcomes, but I'm wondering if
Mhm.
you see that cycle time affecting, especially in people who are trying to get pregnant.
Mm-hmm. Totally, totally. Yeah. And it's funny because it's like the phase of my life seems to match the phase of my patients, and so all of my patients are like perimenopausal patients basically now, where for so long, like my practice was very fertility focused. And yeah, so what is the range of time and days from ovulation to menstruation? Generally, yeah, when you're looking at that, it can be anywhere from like 14 to 21 days, right? Depending on what that cycle might look like. And what I'm looking at, this came up in actually one of the classes, like, are you looking at the more specifics of um, the actual numbers and the data and the cycle maps? I'm actually really a visual person, and I'm sort of just looking at the visuals overall. I want to see that yang spike generally in that mid part of the cycle, right? And when someone, like a couple of these patients had kind of like more prolonged ovulation, even in that first patient, she's 25, so she's a lot younger, um, and is still fluctuating with the timing of her ovulation. Some days it was, I think, day 13 or 14, and then other days it was like more like day 16 to 17. So using the phase bases based formulas to try to keep that ovulation like right in the middle is ideal. And one thing that I love that took me a while to figure out was like, why aren't, I think I reached out to you all. I was like, why isn't there an ovulation formula? Because a lot of other companies use that. And what is real, I think really beautiful, it's not about forcing ovulation. It's really for supporting the blood phase, supporting that yin follicular phase so that ovulation happens on its own and ideally like in the middle of the cycle, right? And then smoothing the rest out. And then using formulas like warm maybe for implantation, right? Or warm and calm even to like try to support that for the body.
Yeah, I mean, there's only so much that we can force the body to do. And when we do force, often we end up creating imbalance. So it's,
Right.
this is why we're, trying to do this
Yeah.
on a screen.
Oh yeah.
Our bodies are really, really, really always trying to be in homeostasis. And the
Totally.
more we push on one end from a sort of harsh pharmacologic or forceful manner, we can create imbalance in the other side. Um,
Right.
we support all the elements to become balanced, then function ideally happens more smoothly. It's not always perfect,
Hmm.
but I think that's the
Right.
beauty of herbal medicine in general, but all TCM in particular, especially with the combining the traditional diagnostic, really good listening, like seeing how what a good history you take and the details you pay attention to that are such core TCM principles, but also shape
Mhm.
good medicine for anybody, regardless of their
Right,
background.
right, right,
And so that is awesome for me to see too, because that's how I try to practice. And uh,
right.
sometimes that listening to patients is more important than the modality necessarily because you're going to get to some good treatment options if you listen really carefully and gather like ask the right questions and then listen to the answers and incorporate it.
Totally. Totally, totally. That's so huge.
Yeah.
Oh
And I
my
think
God.
that's what people are looking for and why so many people go to seek acupuncture and herbal medicine, not just because they're looking for different tools. They might
Hmm.
want both. Like this patient you have,
Hmm.
don't take my drugs away from me. They're helping.
Right, right, totally. Totally.
But she is probably getting more time with you and a lot more
Hmm.
comprehensive care than if
Hmm.
she's seeing her OBGYN or endocrinologist who's like,
Right,
you know,
totally.
15 minutes,
Yeah. Well,
refill.
and yeah, exactly. And I think one of the biggest differences too is we encourage our patients to be able to see us weekly, right? And I think that's what's beautiful about acupuncturists and even some functional medicine doctors might only see their patient one time every 6 months, or once a year, where we're really a part of their like routine and daily or weekly life. And that's where you can really gather so much more about a patient. And I that's what I love about the medicine that we can do.
Aw, thank you.
Yeah.
Well, thanks for sharing your experience.
Thank you.
Again, we'll send out slides to everybody for both sessions so you have them. And one last quick question from our wonderful practitioner and employee, Julia Ursis. How often do you
Yeah.
typically suggest dosing for your patients? Are you dosing once a day, 3 times a day?
I tell people do what you can because I'm also really bad at taking my own herbs. So it's depending on the bottle, like two dropper fulls twice a day. So I usually just have them take in the morning and before bed. If they can do 3 times a day, amazing, but I'm usually doing it twice a day. I think that's a kind of a good mid ground for that.
Sounds good. Well, thank you so much. And we will look forward to next sharing opportunities.
Cool. Thank you so much, Ingrid. Have a
Okay,
good one.
everyone. Yep.
Bye.